So first of all, we have completed our sulfonamides, penicillins, and cephalosporins. Okay, each and everything regarding the pharmacology. We have also seen their chemical aspects. Aminoglycosides. So what do you mean by aminoglycosides? Aminoglycosides. There are two words in this aminoglycosides. So first one is the amino, and second one is the glycoside. So aminoglycosides, as the name indicates, so they are made up of two compounds, two chemical entity. So first one is amino sugar. Amino sugar is the one, two or three or more amino sugars. They are joined together to a hexose molecule. That's why they are known as amino glycoside. Okay. So amino sugars, they are forming a bond known as a glycosidic bond. Two or more amino sugars are there in the amino glycosides. Two or more amino sugars through a glycosidic bond. They are there. They are present. They are bound together by a glycosidic bond to a one central sugar molecule known as a hexose. Okay. So two or three amino sugars, जैसे आपका ग्लूकोज होता है, ग्लूकोज दैट इज अ शुगर, if that is a, अगर उसके एक हाइड्रोजन को अमाइनो ग्रुप लगा दिया या फिर एक हाइड्रोक्सिल ग्रुप निकल के अमाइनो लगा दिया, सो दैट विल बिकम अ अमाइनो शुगर, ग्लूकोसामाइन, ग्लूकोसामाइन, फ्रुक्टोसामाइन, like that. So those amino sugars, they are joined together by glycosidic bond to a one sugar molecule, central sugar molecule. So what are the aminoglycosides? Again, they are a kind of antibacterial drugs. They are known as a broad spectrum antibacterial drugs. Okay, so they are so the two or more amino sugars, they are bound together, glycosidic bond to a central hexose sugar. So two or more amino sugars bound together by a glycosidic bond to a central hexose sugar. Therefore, they are known as a aminoglycosides. So amino sugar plus normal sugar, okay, hexose, and there is a glycosidic bond in between them. That is known as a aminoglycosides. तो उसमें बेसिकली अमाइनो शुगर एक रहेगा और एक नॉर्मल शुगर रहेगा, और अमाइनो शुगर एंड नॉर्मल शुगर दे आर बाउंड टुगेदर बाय ग्लाइकोसाइडिक बॉन्ड. दैट्स व्हाई उनको क्या बोलते हैं अपन, अमाइनो ग्लाइकोसाइड्स. ओके, सो ग्लाइकोसाइड्स मतलब क्या है? इन केस ऑफ ग्लाइकोसाइड्स वी हैव सीन इन द फार्माकोग्नोसी. सो नॉन शुगर पार्ट plus sugar part, they are bound together by glycosidic bond. So similar is true with the aminoglycosides, बस यहाँ पे basically non sugar part नहीं रहेगा, amino sugars, amino sugar and normal sugar, they are joined together by glycosidic bond known as a aminoglycoside. For example, what are the examples of these aminoglycosides? Streptomycin is the very important. Streptomycin, tobramycin is there, amikacin is there, kanamycin is there, neomycin is there, then pharmaceutin is there. So streptomycin, tobramycin, amikacin, neomycin, kanamycin, vancomycin, gentamicin, gentamicin, then streptomycin. These are the examples of aminoglycosides. Remember streptomycin, tobramycin, जिसमें भी mycin आएगा MYCIN या फिर mycin आएगा MICIN. So all these are the aminoglycosides. So streptomycin, tobramycin, amikacin, neomycin, kanamycin, gentamicin, gentamicin, streptomycin. These are the examples of aminoglycosides. Now we'll see the little bit chemistry. Actually, it is not a this lecture is not from a chemical aspect of aminoglycosides. We'll see the chemical aspect in somewhere else. बाद में देख लेंगे उसका. Chemistry, little bit chemistry of aminoglycosides. So what are the structural features of aminoglycoside? कि aminoglycoside के structure में क्या क्या रहेगा? So first thing, one hexose sugar. Okay. Second thing is nothing but the amino sugar joined to hexose sugar by glycosidic bond. Okay. Amino sugar will join to a hexose sugar. So hexose sugar is the first structural component. Second structural component is a amino sugars. So amino sugar will form a bond with the hexose sugar by glycosidic bond. Okay. So amino sugar join to a hexose sugar by glycosidic bond. ये यहाँ पे 2 नहीं, सिर्फ 2TO है. So amino sugar will join to a hexose by glycosidic bond. Then streptomycin is having high molecular weight. So about 582 dalton. Streptomycin has a high molecular weight about 582 dalton, and it is a acidic molecule. It is a anion. It is a acidic molecule, acidic base with 3 parts. Streptomycin में 3 part रहेगा. Okay, 3 parts. Glycosidic linked, they are linked together by glycosidic bond. So यहाँ पे तीन पार्ट रहेगा. So first is the streptidine, then streptose and N-methyl glucosamine. So this is the N-methyl glucosamine is a amino sugar, streptose is a sugar, and streptidine is a base, nitrogenous base. Okay. So again, streptomycin is a high molecular weight compound having 582 Dalton molecular weight. It is an acidic base with the three parts linked together by glycosidic bond. So streptidine, streptose, N-methyl glucosamine. So you have to remember these three. What are the different component of your streptomycin? Streptomycin किससे बना है? ये तीन component से बना है. So streptidine plus streptose plus N-methyl glucosamine. They are highly polar or ionized. Because of that ionization or because of their polar nature, they are very less absorbed from your GIT. They are poorly absorbed from GIT and hence given by parenteral routes. So जितने भी amino glycosides है, so they are not given by oral route. So this is streptomycin, amikacin जो है. Okay, so streptomycin, amikacin, then gentamicin. So they are mostly given by parenteral route because their oral absorption is very poor. They are highly polar and ionized. Because of that, they have very high water solubility. You know that water soluble high molecular weight compound, they are not absorbed well from GIT. So obviously water soluble low molecular weight compound, they are absorbed like sugar, urea and all that. But these are the highly polar water soluble but having high molecular weight 582 Dalton. So that's why their absorption from GIT is poor, and that's why you have to give this compound by in either parenteral route, either intramuscular or intranasal route. So उनका बायो अवेलेबिलिटी बहुत ही कम होता है, ओरल बायो अवेलेबिलिटी. तो दैट्स वाई आपको ये पेरेंट्रली देना पड़ता है. ओके, because of their highly polar nature or because of their highly polar nature, you have to give these amino glycosides by parenteral route. Now because of their higher aqueous solubility, so they cannot cross the blood brain barrier. And you know that for crossing a blood brain barrier, a molecule should have a lipid solubility. तो अगर कोई ड्रग अगर बीबी ट्रिपल बी को क्रॉस करता है तो उसका मतलब है कि उसको लिपिड solubility ज्यादा है. They cannot cross the blood brain barrier and they are very less effective against the, okay, they are effective against the gram negative bacteria and rapidly eliminated by kidney. But what happens in case of meningitis? Meningitis मतलब inflammation of layers of brain. So in case of meningitis, your blood brain barrier becomes weak. Okay, so other antibiotics that they can get entry. So that's why in case of meningitis also some antibiotics are effective. They cannot cross blood brain barrier and that's why they are not used for the meningitis. But in case of inflammation of brain or in case of inflammation of meningitis, so your blood brain barrier becomes weak, antibiotic may get entry. Basically they cannot cross the blood brain barrier. They are highly effective. Okay, they are highly effective against the gram negative bacteria. They are rapidly eliminated by kidney. So these are the structural features. Again, they are having very common adverse effect. Okay, so हर एक अमीनो ग्लाइकोसाइड का common adverse effect होता है. So they are having very common adverse effect like ototoxicity. So they will damage your eighth cranial nerve. Vestibulocochlear nerve, and that's why ototoxicity or deafness. Then they also have nephrotoxicity. Then they also have neurotoxicity and neuromuscular blockage. And all of them are a very low therapeutic index drug. Okay, so they are a narrow therapeutic index drug. These are the some structural features. आपको याद रखना है अमीनो ग्लाइकोसाइड के बारे में. So you have to remember these structural features, okay, regarding amino glycosides. So there will be one hexo sugar, there will be amino sugar. Amino sugar will be joined to a hexo sugar by glycosidic bond. Okay, and particularly streptomycin has a three parts in the structure. These three parts are nothing but the streptidine, streptose, and N-methyl glucosamine. They are very highly polar ionized molecules, and because of that, they will have a high aqueous solubility, and therefore they are not absorbed from GIT. Hence, you have to give these drug by parenteral routes. Okay, parenteral routes. Now they cannot cross the blood-brain barrier. But in case of meningitis, your blood-brain barrier becomes weak and they may get entry into brain. They are highly effective against. यहाँ पे देखो थोड़ा सा, यहाँ पे जो लेस लिखा है ये actually it's strong. They are very effective against gram-negative organism, gram-negative bacteria, rapidly eliminated by kidney, and they are having certain common adverse drug reaction like ototoxicity, nephrotoxicity, neurotoxicity. Okay, and all of them are a narrow therapeutic index drug. All of them are a narrow therapeutic index drug. And development of resistance to the aminoglycosides is very quick against the. Okay, so bacteria will develop quickly resistance against the aminoglycosides. Now, aminoglycoside, a general structure you can see here. So, this one is the amino sugar, this one is the streptose, and this part is known as streptidine. Okay, so it is the structure of your streptomycin. Structural aspect we'll see in another lecture. At the time we'll see the structure active relationship, then structure and all that. Now aminoglycoside. So they are particularly used against the gram-negative organism. So example, streptomycin, kanamycin, gentamicin, tobramycin, amikacin, neomycin. So these are nothing but the aminoglycosides. Now those drugs which are derived from streptomyces, they end with the mycin, MYCIN. So like streptomycin, tobramycin. tobramycin में MYCIN है, streptomycin में MYCIN है, kanamycin में MYCIN है. बट जेंटामाइसिन जो है, जेंटामाइसिन, सो उसमें MYCIN नहीं है, जेंटामिसिन होता है, MICIN. Okay, so gentamicin. So okay, and those drugs which are derived from micromonospora, they are known as the mycins, MICINs. Those derived from streptomyces. Streptomyces में क्या होता है, MICS होता है, तो MICIN. So streptomycin. And those derived from micromonospora. Okay, micromonospora, that is known as the mycins, MICINs. Gentamicin. Gentamicin में ये MICIN. Now chemically they are nothing but the polyketides containing amino sugar in the glycosidic linkage. So antibacterial activity of them, they are having antibacterial activity maximum in the alkaline pH, 7 to 8 pH. They are not adequately absorbed by orally because they are having highly ionized molecule, and they will have a high water solubility, but molecular weight is high, so that's why they are not absorbed orally adequately. They okay, penetration into CSF and eyes also is poor. Now these drugs, they found in the high concentration in the renal cortex. ये किडनी में ज़्यादा concentration में रहेगा. Then it is also found in the high concentration in the endomal, okay, endolymph and perilymph of inner eye, inner ear. तो आपके ear का जो endolymph है, perilymph है, उसमें ये high concentration में जाता है. So that's why it has a nephrotoxicity as well as ototoxicity, because most of the aminoglycosides they concentrate into the kidney. That's why they have a nephrotoxicity, and they can concentrate into endolymph and perilymph of your inner ear, inner part of ear. So that's why they have ototoxicity. They damage the 8th cranial nerve. Okay, that is a vestibulocochlear nerve. So that's why they will have this neurotoxicity, nephrotoxicity and ototoxicity as a adverse. क्वेश्चन ऑलरेडी आ चुके हैं कि ototoxicity के ऊपर, nephrotoxicity. Now classification of aminoglycosides. So depending upon their uses, कि कौन सा एंटीबायोटिक कहाँ पे यूज करेंगे, उसके ऊपर बेसिस के क्लासिफिकेशन होता है उनका. ठीक है. सो aminoglycosides for topical use in the eye and skin infection. So mostly these three: neomycin, okay, neomycin, pharmaceutin and gentamicin. Okay, gentamicin, neomycin and pharmaceutin, they are used for the topical eye infection or topical skin care infection, skin infection. And aminoglycoside which are used for GIT infection, gastrointestinal tract infection. So उसमें आता है आपका neomycin and paromycin. Neomycin and paromycin. So out of that, this neomycin is mostly topically used. It is used in some kind of GIT infection. This drug is very poorly absorbed from stomach. Okay, and that's why it acts as a intestinal antiseptic. That's why it is used in GIT infections locally, provide local antiseptic effect, paramycin and neomycin. Remember now, aminoglycosides for systemic use, for systemic infection. So streptomycin, gentamicin, kanamycin, amikacin, then tobramycin and netilimycin. So gentamicin का है ना MICI. Then general properties of this aminoglycoside. So classification याद रखो आप क्योंकि important है ये. So those for topical use like neomycin, pyrimethamine and gentamicin. Then topical use for skin and eye infection. So mostly skin and eye infection. Then those used for GIT infection like neomycin and paramycin. And for systemic infection, streptomycin, gentamicin, kanamycin, amikacin, and tobramycin and netilimycin. Now, general properties of this aminoglycoside. They are available either as a salt. They are not available as a free base. तो हर एक aminoglycoside का उसका salt ही रहेगा जैसे gentamicin sulfate, streptomycin sulfate. Okay, so they are available as a sulfate salt. They are highly water soluble, stable up to aminoglycosides. They are stable up to months. They are excreted unchanged in the urine. That's why they have nephrotoxicity. All are bactericidal and active in alkaline pH. They will have dose dependent killing. Okay, dose dependent killing. In smaller dose they will act as a bacteriostatic. In larger dose they will act as a bactericidal. Okay, and they will also have one more property known as a post antibiotic effect or post treatment effect or after treatment effect. मीन्स इसमें आफ्टर ट्रीटमेंट इफेक्ट क्या होता है कि अमीनोग्लाइकोसाइड दे दिया आपने, तो आइडियली क्या होना चाहिए कि जब तक ड्रग का कॉन्सेंट्रेशन आपके बॉडी में है तब तक वो ड्रग ने एंटीबैक्टीरियल इफेक्ट दिखाना चाहिए, और जब आपके बॉडी से ड्रग निकल गया सो ऑब्वियसली एंटीबैक्टीरियल इफेक्ट कहाँ से मिलेगा. ये होता है नॉर्मल एंटीबायोटिक केस, बट देयर आर सर्टेन एंटीबायोटिक्स व्हिच विल शो आफ्टर ट्रीटमेंट इफेक्ट. Okay, means all drug from your body has been eliminated, has been removed, but still it is inhibiting the growth of bacteria. So that is nothing but the post antibacterial effect or post effect, post antibacterial effect or post therapeutic effect. Okay, so उनको है. So aminoglycosides they are dose dependent कि they are dose dependent killing. जैसे डोज बढ़ेंगे उसका एक्शन उतना बढ़ेगा. So initially at a lower concentration they will act as a bacteriostatic, and higher concentration they are a bactericidal. They show dose dependent killing. Okay, and they also have post antibiotic effect. Remember this. यहाँ पे कुछ चीजें मेंशन नहीं हुए लेकिन बोला है मैंने. All of these drugs they have less margin of safety. They are having narrow therapeutic index. They are having less margin of safety, and they will have these adverse effects common in there. Okay, like ototoxicity, nephrotoxicity, and nephrotoxicity and ototoxicity. बाकी के जो रिएक्शंस होते हैं जैसे लोकल रिएक्शन जीआईटी अपसेट वगैरह वो तो कॉमन होता ही है. मैकेनिज्म ऑफ एक्शन इज इम्पोर्टेंट. they used to ask question on this mechanism of action of aminoglycosides. So what happens when you take a drug? So that drug get diffused into bacterial cell. Diffusion of antibiotic across the outer coat of gram-negative bacteria through porine channels. So bacteria will have these porine channels on their cell wall. Bacteria में एक porine channels होते हैं. So entry of this drug will get diffused. मतलब ये diffusion होता है उसका inside the bacterial cell. Okay. So this antibiotic will have diffusion in the bacterial cell wall via porine channels, and entry perisplasmic species is carrier mediated. So there are two ways that aminoglycoside can get entry into bacterial cell. बैक्टीरियल सेल में जाने के लिए दो रास्ते हैं. सो एक तो ये डिफ्यूज होता है बाय पोरिन चैनल के थ्रू, और दूसरा होता है कि ये पेरिप्लाज्मिक स्पेसेस जो होता है बैक्टीरियल सेल वहां से भी जाता है बाय कैरियर मेडिएटेड ट्रांसपोर्ट व्हिच इज लिंक्ड टू ईटीसी. नाउ पेनिट्रेशन इज डिपेंडेंट अपॉन द मेंटेनेंस एंड पोलराइज्ड मेम्ब्रेन एंड ऑक्सीजन. सो ये जो डिफ्यूजन होता है या फिर पेनिट्रेशन ऑफ एंटीबायोटिक जो होता है बैक्टीरियल सेल में, that is based upon this. Penetration is based dependent upon the maintenance of polarized membrane. Membrane जब तक polarize है तब तक वो drug अंदर जाएगा. Otherwise, now aminoglycosides once they reach inside the cell, they will bind to a दिस 30th राइबोसोमल सब यूनिट ऑफ बैक्टीरिया। बैक्टीरियल राइबोसोम क्या होता है कि 70s होता है, 70s होता है, 50s एंड 30s उसका सब यूनिट होता है। 70s राइबोसोम होता है प्रोकैरियोट में, यूकैरियोट में 80s राइबोसोम होता है। सो विल सी दिस protein synthesis tomorrow in the detail. Okay, so ideally I should have taken protein synthesis first and then I have to take. तो जब प्रोटीन सिंथेसिस होता है उसमें डिफरेंट डिफरेंट स्टेप्स होते हैं, जैसे इनिशिएशन, देन इलोंगेशन, देन टर्मिनेशन, एक्सेट्रा एक्सेट्रा। सो उसमें एमआरएनए आता है आपका, टीआरएनए आता है आपका, ठीक है। एमआरएनए के अकॉर्डिंगली टीआरएनए वहाँ पे अमीनो एसिड लाने का काम करता है और फिर वो डीएनए पॉली, ठीक है, उसके बाद में वहाँ पे एंजाइम का रोल रहता है। सो दैट विल, ओके, सो अमीनो एसिड ट्रांसफरेज एंजाइम, so different enzymes, and that will lead to synthesis of protein according to the codons present on mRNA. There are two subunits of prokaryotic ribosome. That is a prokaryotic ribosomes, that is nothing but the 70s ribosome, and their subunit are like 30s and 50s. Okay, so what is yes? Yes is nothing but the sedimentation coefficient. Aminoglycosides, once they got entry into the bacterial cell, they attach or they bind to the 30th ribosome and interfere with the action of protein synthesis. Interfere means they block the protein synthesis. They causes freezing, okay, they causes freezing or block of translation of mRNA. So translation of mRNA means protein synthesis. So they binds to 30th ribosome and inhibit the protein synthesis and prematurely terminate the protein synthesis. Incorrect amino acids, they are incorporated into a protein chain leading to production of abnormal protein. तो अगर जितना भी प्रोटीन बना है वो भी abnormal बनता है. They used to bind to 30th ribosomal subunit of bacterial ribosome and inhibit the or block the step of protein synthesis. Okay, and जितना भी प्रोटीन सिंथेसिस होगा वो इनकरेक्ट अमीनो एसिड आता है उसमें. Incorrect amino acid are incorporated into protein synthesis. Therefore, this protein gets inserted into cell membrane. अगर faulty protein बना तो वो वहाँ पे faulty properly protein जाना चाहिए. So faulty protein अगर गया bacterial cell wall में, so cell wall will become weak and it gets disrupted. So aminoglycoside exhibit dose dependent killing of microorganisms. Dose dependent killing of microorganisms. Mechanism समझ में आया? Yes. सो अमीनोग्लाइकोसाइड आपने इंजेक्शन लिया, ठीक है, आपको कोई इन्फेक्शन होगा तभी एंटीबायोटिक देंगे ना आपको. सो इफ यू गॉट अ इन्फेक्शन ऑफ ग्राम नेगेटिव बैक्टीरिया, सो देन दे विल गिव यू एंटीबायोटिक. ओके, सो इन्फेक्शन कहाँ पे है? आपके ब्लड में है ना इन्फेक्शन. सो व्हेन दिस एंटीबायोटिक्स इज गिवन, इट गेट डिफ्यूज्ड अक्रॉस द बैक्टीरियल सेल. तो बैक्टीरियल सेल जो होता है, बैक्टीरियल सेल वॉल में एक पोरिन चैनल होता है, जैसे आपका एब्सॉर्प्शन के लिए आयन चैनल से ये सब होता है ना, तो सॉरी एब्सॉर्प्शन के लिए वो एक्वेस चैनल्स हो गए, तो उस तरीके से पोरिन चैनल्स वो आप बैक्टीरिया में होते हैं और पोरिन चैनल्स के थ्रू अमीनोग्लाइकोसाइड डिफ्यूज होगा. डिफ्यूज मतलब वो ब्लड से बैक्टीरियल सेल में चला जाएगा. और दूसरा एक रास्ता होता है आपका, इट विल आल्सो गेट एंट्री थ्रू पेरिप्लाज्मिक स्पेसेस व्हिच इज अ कैरियर मेडिएटेड, okay, and lead to electron transport chain. Now penetration is dependent upon the maintenance and polarized maintenance of cell membrane in a polarized state and oxygen. तो ऑक्सीजन और पोलराइज्ड स्टेट जो होता है मेम्ब्रेन का, उसके ऊपर पेनिट्रेशन डिपेंड है, मतलब कितना अमाउंट, कितना क्वांटिटी अंदर जाएगा सेल में. Now once it got entry into the bacterial cell, it will bind to a 30th ribosome, 30th ribosomal subunit of bacterial ribosome. बैक्टीरिया में राइबोसोम जो होता है, राइबोसोम्स आर नथिंग बट द, दैट इज द फैक्ट्री फॉर सिंथेसिस ऑफ प्रोटीन्स. ठीक है, तो आपको अगर इन्फेक्शन हो गया तो इन्फेक्शन होने के बाद में, जैसे इन्फेक्शन होने के बाद में जो बैक्टीरिया है कि 10 बैक्टीरिया आपके बॉडी में चलेगी, तो वो 10 ही नहीं रहेंगे. ओके ओके, सो दे विल ट्राई टू मल्टीप्लाई देमसेल्फ. वो मल्टीप्लाई करेंगे ना आपके बॉडी में. ओके, तो मल्टीप्लाई करने के लिए उनको क्या है, वही फिर डीएनए का ट्रांसलेशन होगा, सॉरी डीएनए का रेप्लिकेशन होगा, डीएनए से आरएनए बनेगा, दैट इज ट्रांसक्रिप्शन. और ट्रांसक्रिप्शन के बाद में एमआरएनए से क्या बनेगा, प्रोटीन बनेगा, दैट इज अ ट्रांसलेशन. ओके, नाउ अमीनोग्लाइकोसाइड बाइंड्स टू द पर्टिकुलरली दिस ट्रांसलेशन प्रोसेस. जो ट्रांसलेशन प्रोसेस होता है उसको बाइंड करेगा. तो ट्रांसलेशन प्रोसेस में होता क्या है ये अपन कल देखेंगे प्रॉपरली. ओके, सो ओवरऑल मैं आपको बोल देता हूँ कि सो ट्रांसलेशन प्रोसेस में क्या होता है कि जो एमआरएनए होता है आपका, सो mRNA के अकॉर्डिंगली आपको प्रोटीन बनाना है. So that is the translation. Translation means synthesis of protein from mRNA. Okay. So what? Okay. So for that you need mRNA, you need a base pairs. Okay. Sorry, you need a mRNA, you need a tRNA, transfer RNA, you need a 20 amino acids because proteins are nothing but the polymer of amino acids. Okay. You need amino acids, enzymes, okay, and energy. So we'll see tomorrow. बैक्टीरिया में क्या होता है कि जो राइबोसोम होता है दैट इज 70s राइबोसोम. यस मतलब सेडिमेंटेशन कोएफिशिएंट होता है वो. ओके. सो 70s राइबोसोम होता है एंड दैट इज अ splitted or subunit of that 70s is nothing but 30s plus 50s. Okay. So aminoglycoside binds with the 30s ribosomal subunit and interfere with the protein synthesis of bacteria. बैक्टीरिया का प्रोटीन सिंथेसिस बंद कर रही है. Okay. So they will cause block of protein synthesis, block of translation of mRNA. They will cause freezing of protein. Okay. And per prematurely terminate the protein synthesis. प्रोटीन सिंथेसिस का इनिशिएशन होता है पर्टिकुलरली, उसका इलोंगेशन होता है, उसके बाद में टर्मिनेशन होता है, वो सब बायोलॉजिकल प्रोसेस है. बट दिस एंटीबायोटिक्स दे बाइंड्स टू 30s राइबोसोम एंड दे विल टर्मिनेट द प्रोटीन सिंथेसिस प्रीमैच्योरली विदाउट कंप्लीशन. कंप्लीट होने से पहले बंद कर दें. एंड ड्यूरिंग दिस प्रोसेस देयर माइट बी incorporation of incorrect amino acids, incorrect amino acid in the growing peptide chain. And incorrect amino acid, if there is incorporation of incorrect amino acid, there is a formation of incorrect protein. जो भी जितना भी बना है प्रोटीन उतना इनकरेक्ट बनेगा. एंड बिकॉज ऑफ दैट इनकरेक्ट प्रोटीन, जो इनकरेक्ट प्रोटीन बना है वो बाद में कहाँ पे सेल. सो वट एवर प्रोटीन सिंथेसाइज्ड by bacteria that is utilized for the making of bacterial cell wall, bacterial cell component, etc., etc. Okay. So that protein is not let synthesized by this aminoglycosides. Okay. So aminoglycosides also exhibit dose dependent killing. तो जितना ज़्यादा डोज होगा उतना ज़्यादा किल करें. They exhibit dose dependent killing. Now this is the mechanism. तो aminoglycoside 30s राइबोसोम को बाइंड करता है और जो मैक्रोलाइड होता है वो 50s राइबोसोम को, और जो टेट्रासाइक्लिन होता है वो टेट्रासाइक्लिन जो होता है वो 50s राइबोसोम को बाइंड करता है. सो देयर आर टू सब यूनिट ऑफ राइबोसोम, बैक्टीरियल राइबोसोम. तो ह्यूमंस में जो राइबोसोम होता है उसको 80s बोलते हैं. 80s सेडिमेंटेशन कोएफिशिएंट उसका 80 है, उसके लिए उसको 80 बोलते हैं. तो बैक्टीरियल राइबोसोम का सेडिमेंटेशन कोएफिशिएंट 30 है तो उसको 30s बोलते हैं. तो उसका भी ओके. सो सॉरी 30 नहीं 70s बोलते हैं उसको. सो उसमें भी सब यूनिट होता है. 70s में 50s सब यूनिट होता है और 30s सब यूनिट होता है. सो aminoglycoside bind to 30s सब यूनिट कैन ब्लॉक द प्रोटीन सिंथेसिस. नाउ रेजिस्टेंस कैसे डेवलप होता है. सो माइक्रोऑर्गेनिज्म कैन गेट रेडिली microorganism can readily develop the resistance to the aminoglycosides. Particularly these organisms like pneumonia, mycobacterium tuberculosis, proteases, E. coli, Arobacter, H. influenza, then Staphylococcus aureus, Staphylococcus faecalis, okay, Brucella. ये organism resistance develop होता है उनको. So they acquire resistance. Now they acquire resistance by this mechanism involved in the resistance. So at a low level resistance to the aminoglycoside is because of the decreased permeability. जो diffuse होता है antibiotic bacterial cell में वो कम हो जाएगा. So that's why bacteria will develop a resistance. So due to decreased permeability of the cell membrane to a antibiotic. So that is the responsible for the low level resistance. Then second one is the R factor mediated resistance or plasmid mediated resistance. मतलब क्या, अगर मान लीजिए कि कुछ बैक्टीरिया में रेजिस्टेंस आ गया उसका एंटीबायोटिक का. सो बैक्टीरिया ट्राइज टू मल्टीप्लाई देमसेल्फ, वो भी अपना वंश बढ़ाएंगे. सो जब वो मल्टीप्लाई करते हैं तो उसमें उनका जेनेटिक मटेरियल ट्रांसफर होता है. एंड यू नो दैट देयर इज अ सर्कुलर DNA in the bacteria known as a plasmid. So plasmid mediated resistance. So different. So they will try to find out the alternate process to survive in presence of that antibiotic. So different in the genetic material transfer during conjugation. That conforms the cell to synthesize a specific enzyme which can destroy the drug. ठीक है. बैक्टीरिया क्या करेंगे, वो अल्टरनेट पाथवे ढूंढ लेंगे कि इसको टैकल कैसे करना है. तो दे विल make change in their genetics. They will produce certain enzymes which can destroy the drug, or they will produce such kind of protein which is not sensitive to antibiotics. So that is known as a plasmid mediated resistance or R factor mediated resistance. Then high level resistance. It is due to a single step mutation in the bacterial ribosomal protein. Okay. That's how they may get resistance. There are three resistance mechanisms. Okay. Now antibacterial activity. So aminoglycosides they are effective against these organisms. Sensitive organisms to the streptomycin are Mycobacterium tuberculosis, Shigella, E. coli, Pseudomonas aeruginosa, Aerobacter proteases. So particularly जो this Mycobacterium tuberculosis है, so streptomycin is a reserve drug for Mycobacterium tuberculosis. It is a reserve drug, a reserve class 2 drug. Okay. Then moderately sensitive organism. So these organisms they are moderately sensitive like Staphylococci, yes, pyrogen, gonococci, meningococci. They have variable sensitivity. So highly sensitive ones है ये Mycobacterium tuberculosis, Shigella, E. coli. They are not going to ask you this okay sensitivity and all that. They are going to ask you regarding mechanism of action, mechanism for resistance, specific adverse effect and uses. Now ADME, absorption, distribution, metabolism, elimination. So streptomycin is poorly absorbed from GIT because it is a highly polar molecule and high molecular weight compound. So it will act as an intestinal antiseptic. Now if you give streptomycin by intramuscular route, so peak plasma level will appear within a 30 or 60 minutes. Okay. Now they are also well absorbed from intrapleurally. जो pleural fluid होता है, pleural cavity होता है, वहाँ से भी absorb. It can be removed from hemolysis. It can be removed from blood by effectively doing hemolysis. It diffuses into synovial and pericardial fluids. It is metabolized and excreted in the urine. So mostly it is excreted as unchanged. इसका ज़्यादा metabolism होता नहीं. So next part we'll see adverse reaction. It is very very important. उनका adverse reaction ज़्यादा important. So adverse reactions. So local irritation like pain at a injection site. जहाँ पे injection दिया वहाँ पे उसका pain हो जाएगा, inflammation हो जाएगा. Okay. So upon intramuscular injection, abscesses, fever may develop, pain, paralysis. Then intrathecal administration. So if you give injection into the spinal cord, okay, intrathecal administration, so shock state and pyrexia, respiratory depression and convulsion may occur. Now allergic reactions, so skin rash, exfoliative dermatitis, blood dyscariasis, pericarditis and angioedema. These are the allergic reaction. CNS symptoms. CNS के ऊपर क्या रहेगा? First ototoxicity. So they will damage 8th cranial nerve, vestibulocochlear nerve, and they will cause ototoxicity, deafness. बहरे हो जाओगे आप. Okay. So impairment of vestibular function, which leads to deafness, tinnitus, rarely optic neuritis and peripheral neuritis. So they have neurotoxicity also. So न्यूरॉन को टॉक्सिटी करेगा, पेरिफेरल न्यूरोपैथी भी कर सकता है आपको, ऑप्टिक न्यूरोपैथी भी कर सकता है, but they are rare. So most commonly peripheral neuropathy is because of the isoniazid. Isoniazid जो होता है ethambutol isoniazid, anti-tubercular drug, they causes the peripheral neuropathy. So they damage the 8th cranial nerve and causes the deafness, cochlear damage, vestibular damage. Okay, so these are the symptoms. So ये important है. Now neuromuscular blockage, they also causes neuromuscular block like curare alkaloids. So all aminoglycosides block the neuromuscular junction like curare alkaloid. It can be reversed by administration of neostigmine. Then kidney में क्या है? Nephrotoxicity. So they have nephrotoxicity. Okay, because they are mostly concentrated in the urine and they are excreted unchanged. So that's why. So mild albuminuria, acute tubular necrosis, and this cylindruria. That means it's also inflammation of nephritis. Then super infection with Streptococcus aureus and Candida albicans. So याद रखो locally irritation करेगा, fever करेगा, abscess करेगा इंजेक्शन साइड पे. ठीक है. इंट्राथिकल इंजेक्शन देंगे तो उसमें कन्वर्जन भी हो सकता है, पायरेक्सिया, रेस्पिरेटरी डिप्रेशन हो सकता है, और इन अ शॉर्ट शॉक स्टेट एक्यूट शॉक टेस्ट हो सकता है, मतलब शॉक मिल सकता है आपको एक्यूट नॉर्मल. ओके. सो लोकली अगर देंगे तो वहाँ पे एब्सेस होगा, इन्फ्लेमेशन होगा, पेन होगा. देन इंट्राथिकली अगर देंगे इन द स्पाइनल कॉर्ड, So that can result in the shock, acute shock test, pyrexia, respiratory depression and convulsions locally. बाकी उसका सिस्टमिकली देंगे तो स्किन रैश, एक्सफोलिएटेड डर्मेटाइटिस, ये एडवर्स इफेक्ट, एक्सफोलिएटेड डर्मेटाइटिस, ब्लड डिस्कैरियोसिस, एंजियोइडेमा, पेरिकार्डियाइटिस। ओके, सीएनएस के ऊपर क्या करता है? इट विल कॉज ओटोटॉक्सिटी, इट विल डैमेज द एट क्रैनियल नर्व, impairment of vestibular function, deafness, tinnitus, rarely it can cause optic neuritis, ऑप्टिक नर्व जो है उसका भी ये उसको भी ये डैमेज कर सकता है। देन ऑप्टिक न्यूराइटिस, पेरिफेरल न्यूराइटिस आल्सो, cochlear damage, vestibular damage. Okay, these are the main adverse. Again, they can block the neuromuscular junction. So they are all amino-glycosides are neuromuscular blocker, but it can be reversed by neostigmine. Now kidney के ऊपर they have a nephrotoxicity like mild albuminuria, तो आपके यूरिन में अल्बुमिन आएगा, acute tubular necrosis और सिलिंडूरिया, वही दोनों सिम्टम है, सिलिंडूरिया। देन सुपर इन्फेक्शन। सो सुपर इन्फेक्शन मतलब क्या? अमीनो ग्लाइकोसाइड का अगर ट्रीटमेंट चालू है आपको, सो इफ यू आर अंडरगॉन अमीनो ग्लाइकोसाइड treatment by any antibiotic, so what will happen? So antibiotic will not discriminate your helpful organism. Okay, so your GIT has a microbial flora. आपके GIT में बहुत सारे माइक्रोब्स होते हैं जो आपको हेल्पफुल है, दे आर नॉट harmful. Okay, they are not harmful. So if you are undergoing any treatment, so what will happen? But antibiotic is not able to discriminate, is not able to distinguish between pathogenic organism and your helpful organism. So antibiotic used to kill all kind of organism. तो वो जो जिसने डिसीज किया है उसको मारेगा, और आपके पेट में जो यूजफुल है, जो whatever microbial flora is there in your GIT responsible for the synthesis of vitamin B, synthesis of vitamin K, etc., etc. So that also will be destroyed and will cause diarrhea and etc., etc. Okay, and because of that may become vulnerable for infection of other microorganisms. So that is nothing but the yes auris and candy albuins. That is known as super infection. After treatment आपका immunity कम होता है. So that is a super infection. Now again ये aminoglycosides how they will not affect our own cells. ठीक है कि माइक्रोबियल सेल को ही डैमेज करता है, क्यों? अपने सेल को क्यों नहीं करता? ओके, सो हाउ इट selectively kills the microbes, not a human cell. There is one reason, because in the bacterial cell the antibiotic get diffused inside the cell via porin channels, and one more is there, so that is the active transport, but such kind of transport is not available in our human cell. That's why this aminoglycosides they only kills the only kills the microorganism, not human cell. Okay? नहीं तो फिर अपने सेल को मार देगा तो आदमी मर जाएगा. These are the adverse reactions you have to note. Irritation, allergy, then vestibulocochlear nerve का, ठीक है, nephrotoxicity, neuromuscular blockage. They are vulnerable for super infection with this SORS and Candida albicans. Therapeutic uses, so उसका यूज क्या रहेगा? पर्टिकुलरली स्ट्रेप्टोमाइसिन, ये स्ट्रेप्टोमाइसिन के बारे में ही मैक्सिमम देखना है, बाद में अपन इंडिविजुअल देखेंगे. सो मेनली यूज its use is restricted for the treatment of tuberculosis because there is a development of resistance. So mainly use is restricted to tuberculosis treatment due to development of resistance. Now plague. So remember question आ चुका है. So streptomycin is a highly specific drug of choice in the treatment of plague. Now what is plague? Plague is caused by Yersinia pestis organism. Yersinia pestis. So which is sensitive to streptomycin. So streptomycin is drug of choice in case of plague. It is an animal borne disease. Animal जैसे plague कहाँ से होता है? उन चूहों से होता है, ठीक है, चूहों से होता है. They are nothing but the vectors. So it is used in the pregnant woman, old people, okay, for treatment with the pneumonic plague. So plague के कारण अगर pneumonia हुआ तो ये यूज करेंगे. Okay, tetracyclines also can be used with the combination. So they are the drug of choice in case of plague. Remember, streptomycin is a drug of choice in case of tularemia. Tularemia is also one of the bacterial disease from the animal origin. जैसे अभी एक चल रहा है कि गाय को एक डिसीज हो गया, अभी याद नहीं उसका नाम मराठी में क्या है. That is a kind of tularemia. Tularemia is nothing but a serious bacterial infection which leads to ulcers, surface ulcers. जो स्किन के ऊपर है वो अल्सरेशन होता है, उसमें स्किन के ऊपर अल्सरेशन होता है, टॉलरेमिया. सो इट इज इन्फेक्शियस हाईली सेंसिटिव टू स्ट्रेप्टोमाइसिन. तो इसको ट्रीटमेंट के लिए भी स्ट्रेप्टोमाइसिन. सो प्लेग, ट्रीटमेंट ऑफ प्लेग, टॉलरेमिया, देन ब्रुसेलोसिस इट इज ऑल्सो इन्फेक्शन फ्रॉम द एनिमल्स. जैसे आप डेयरी प्रोडक्ट खाते हो, जैसे मिल्क मिल्क लेते हो डेली, आप चीज लेते हो. सो इफ देर इज अ कंटेमिनेटेड मिल्क फ्रॉम द एनिमल, so that may cause brucellosis. Then rifampicin plus doxycycline is used for treatment of brucellosis. Streptomycin is result drug for this tuberculosis, that's why. So if doxycycline is contraindicated, then streptomycin can be used. Now again, streptomycin also used for enterococcal infection along with the penicillin G. So enteric fever particularly. Streptomycin is sometimes used in the these kind of serious infections. So यहाँ पे ट्यूबरकुलोसिस में यूज करते हैं, प्लेग में ड्रग ऑफ चॉइस है, टॉलरेमिया में यूज होता है, ब्रुसेलोसिस में यूज होता है, इंट्रोकोकल इन्फेक्शन में यूज होता है. These are the use of streptomycin. Now individual aminoglycosides. तो हर एक का थोड़ा थोड़ा देख लेते हैं. So first one is kanamycin. So it is obtained from Streptomyces kanamyceticus. So Streptomyces kanamyceticus is the source. Okay, इसके बारे में सोर्स के बारे में पूछते हैं कभी कभी, कहाँ से बनता है कैनामाइसिन, स्ट्रेप्टोमाइसिस कैनामाइसेटिकस. ओके, तो कैनामाइसेटिकस फॉर कैनामाइसिन, इट इज सिमिलर टू स्ट्रेप्टोमाइसिन बट इट इज मोर टॉक्सिक देन स्ट्रेप्टोमाइसिन. देन नेक्स्ट वन इज जेंटामाइसिन. जेंटामिसिन यहाँ पे स्पेलिंग करेक्ट है, जेंटामिसिन. सो इट इज ऑब्टेन फ्रॉम माइक्रोमोनोस्पोरा परपुरा. सो इसके ऊपर क्वेश्चन ऑलरेडी आ चुका है, व्हाट इज द सोर्स फॉर gentamicin? It is obtained from Micromonospora. Now again it is a broad spectrum aminoglycoside antibody. So adverse reaction क्या है gentamicin के? So skin reaction, phototoxicity. It may damage your vestibular nerve. So phototoxicity. It may increase the urea in the blood. So blood urea, okay, rise in the blood urea nitrogen. It is not used in the pregnancy. So what is used? It is used topically for the treatment of burns. Okay, burns, bed sores. जैसे मान लीजिए कोई बंदा आईसीयू में है 2-3 महीने से, तो उसको क्या होता है कि बेड सोर हो जाते हैं. So for the treatment of bed sore, this gentamicin is used. Okay, it is also used for the nasal caries. Okay, nasal caries caused by staphylococci. nasal का जो इन्फेक्शन है स्टेफिलोकोकस, urinary tract infection, bacterial endocarditis, peritonitis, meningitis, ओस्टियोमाइलिटिस. ओस्टियोमाइलिटिस मतलब इन्फेक्शन ऑफ बोन्स, मेनिंजाइटिस मतलब इन्फेक्शन ऑफ योर लेयर्स ऑफ ब्रेन, एंडोकार्डाइटिस मतलब एंडोकार्डियम का इन्फेक्शन, पेरिटोनाइटिस मतलब स्टमक का इन्फेक्शन. ओके, मतलब देन ओटाइटिस, देन बर्न, सेप्टिक बर्न, pneumonia, septicemia. So these are the uses of gentamicin. Next one is tobramycin. Tobramycin is obtained from Streptomycus tenebrarius. Tobramycin is obtained from Streptomyces tenebrarius. So tobra for tenebra और रिलेट कर सकते हो. कैनामाइसिन में क्या है? स्ट्रेप्टोमाइसिस कैनामाइसेटिकस. बस इतना याद रखो, जेंटामाइसिन इज फ्रॉम माइक्रोमोनोस्पोरा पर्पुरा, tobramycin from Streptomyces tenebraris. Now it is again 4 times more active than gentamicin for Pseudomonas aeruginosa, relatively less toxic than gentamicin. So tobramycin use करते हैं. Now amikacin, it is a semi-synthetic derivative of kanamycin A. So it is a broadest spectrum antibacterial drug amongst the aminoglycosides. So amikacin आजकल भी यूज होता है. Use and adverse effect is similar to gentamicin. Neomycin, it is obtained from Streptomyces paradi. बार में क्वेश्चन पूछा है, Streptomyces paradi. Neomycin, Streptomyces paradi is obtained from Streptomyces paradi, and mostly it is used as the intestinal antiseptic, or it is used topically for treatment of infections. So neomycin used topically. Okay, so it is applied on the skin and eyes. It is also intestinal antiseptic. Then pharmaceuticals. So it is obtained pharmaceuticals is obtained from Streptomyces dicaris. तो ये सोर्स याद रखो उसका, Streptomyces dicaris. Okay, so it is also a topical antiseptic antibacterial drug. So local application to skin and nasal कैरीज टू स्टेपेलोकोकाई। तो इसका एक क्रीम आता है, देखो इसका नियोमाइसिन का भी क्रीम आता है आपको, एक 10 रुपीज में 10 ग्राम का क्रीम आता है नियोमाइसिन का। देन फ्रामाइसिटिन का भी एक आता है क्रीम, सोप्रामाइसिन नाम है इसका, फ्रामाइसिटिन का सोप्रामाइसिन। देन नेक्स्ट ड्रग इज पैरामोमाइसिन, सो इट इज ऑब्टेन फ्रॉम स्ट्रेप्टोमाइसिन ramosus. Paromycin is obtained from Streptomycin ramosus. So it is active against anti-amoeba histolytic. तो डायरिया करता है ना, anti-amoeba histolytic. Effect in the visceral leishmaniasis, but treatment may cause super infection with the Candida albicans. Now non-aminoglycoside antibiotics. So they are not aminoglycoside antibiotic, but their mechanism, some of them have mechanism similar to that. Now first one is a colistin or polymyxin E. Colistin or polymyxin E obtained from Aerobacillus colistinus. Okay, Aerobacillus colistinus. So colistin or polymyxin E. याद रखो polymyxin E is also known as a colistin. So what is the mechanism? So it causes disruption of phospholipid of the cell membrane because of its detergent property. क्वेश्चन इसके ऊपर आता है कि वन ऑफ द फॉलोइंग एंटीबायोटिक will will damage the bacterial cell membrane by its detergent property. Colistin sulfate. Colistin sulfate आता है सॉल्ट इसका, तो polymyxin E. So it causes the disruption of phospholipid of the cell membrane of bacterial cell and by its detergent property. So it is active against the gram negative organism. Oral absorption is poor. Okay, so orally absorb नहीं होगा क्योंकि बोला है कि it is water soluble, highly ionizable drug. So adverse drug reaction includes local pain, lingual paresthesia, skin rash, vertigo, ataxia, pruritus, partial deafness, hypertoxicity, and granulocytopenia, disturbance in the vision and speech. So these are the adverse effects of colistin sulfate of polymyxin E. The polymyxin B obtained from Bacillus polymixa. Okay, polymixa, Bacillus polymixa. Polymyxin B, Bacillus polymixa. Polymyxin E, Bacillus cholestimulus. Okay, so याद रखो. Again, it is a polypeptide antibiotic for local. कुछ इसमें बुक में भी नहीं दिया. Thyrothricin. Next one is thyrothricin. So it is obtained from Bacillus brevis. Bacillus brevis. Okay, it is a mixture of two antibiotics. Mixture of thyrocidine and germicidin. Mixture of thyrocidine and germicidin. 80:20. Now this thyrocidine is a bacteriostatic drug, and this germicidin is a highly toxic drug. Germicidin is highly toxic. So thyrothricin is a combination. It is a mixture of thyrocidine and germicidin. इतना याद रखो. The next one is cycloserine. It is obtained from Streptomyces orchidaceus. Streptomyces orchidaceus. Okay, cycloserine. So it is a second line drug for treatment of tuberculosis. Also used in the E. coli resistance urinary tract infection. Streptomycin. Okay, spectinomycin. Next one is spectinomycin, obtained from Streptomyces spectabilis. From Streptomyces spectabilis. It is a aminocyclitol. So it is a aminocyclitol. It is not a aminoglycoside. Aminocyclitol, not aminoglycoside. Mainly used to treat the angiogenital gonorrhea alternative to penicillins. If penicillins are ineffective, then spectinomycin is used. Next one is the phosphomycin. Mechanism of action देखो. As it is a phosphoric acid derivative, it inhibits the bacterial cell wall synthesis by inactivating the enzyme pyrovyl transferase. This enzyme is very important for bacterial cell wall, for synthesis of bacterial cell wall compound. Pyrovyl transferase enzyme जो है वो important होता है bacterial cell wall compound के लिए. And ये phosphomycin क्या करता है? It is a phosphonic acid derivative which inhibits the bacterial cell wall synthesis by inhibiting the enzyme pyrovyl transferase, which is a critical in synthesis of bacterial cell. Adverse drug reaction देखो इसके. Abdominal discomfort, diarrhea, pruritus, drowsiness, anorexia, rash. It is used for the uncomplicated UTI in the woman, urinary tract infection in the ladies. Now next one is a monobactam. So ठीक है, monobactam. ये देखो आता mono AIMS. So monobactam. There are three words: monobact and lactam. Monobact and lactam. There are three words: monobact and lactam. So during the research, American pharmacopoeial industry, they were in the search of antibiotic and from the soil origin. So they developed this. They isolated this antibiotic monobactam. So mono is often found. Mono means having only one ring. Okay, mono. Bact means often from bacteria. Okay, and terms मतलब lactam ring. Okay, so ये ऐसा एंटीबायोटिक है that is having only one ring in the structure, obtained from bacteria, not from fungus. So other beta lactam antibiotics जैसे आपका पेनिसिलिन हो गया, सेफलोस्पोरिन हो गया, या फिर आपका क्लेवरोनिक एसिड, या फिर जो बाकी है मेरोपेनम वगैरह, इमीपेनम. So those are obtained from fungus. Okay, so molds. So monobactam, it is not obtained from fungus, it is obtained from bacteria. Mono means having one ring, bactam is bacteria, and tum lactam. Okay, so lactam is having beta lactam ring in the structure. So these monobactams, they are having beta lactam antibiotic beta lactam ring in the structure, but they are not obtained from fungus. Okay, तो उसमें एक ड्रग आता है एजिट्रियोनम. It is a beta lactam antibiotics not produced by fungus or mold. So it is produced by this bacteria. It is produced by this bacteria known as a Chromobacterium violaceum. Chronobacterium violaceum. So it is resistant to the beta lactams. Does not have adverse effect like aminoglycosides. So it will not cause ototoxicity and all that. Used as an alternative to the aminoglycoside in the neonatal gram negative infection. बच्चों में जो GE negative infection होता है, in patient with the allergic to penicillins and cephalosporins.